Hello everybody, today I'll be making my Unit 5 journal video. So today I'll be talking about a scenario where I haven't seen or where there is a rare scenario. I'll be talking about a rare scenario. So I'll be talking about this 32-year-old female. So this lady was being diagnosed of factitious disorder. So what this disorder means is that the providers were thinking that her symptoms are like manipulative, like they are like self-induced, because she presents with seizures, presents with mental health disorders, and she's present with GI disorders. So they've done a lot of investigations for this patient, and nothing seems to be working. And during the process of like getting the history, you find out that the patient is sometimes the affect is incongruent. Like sometimes the patient is talking off point, like she's having flight of ideas, she's like tangentiality, things like that. So what happened is sometimes she's filled with medical jargons. That's what's keep happening with this patient. This patient has had like not less than 20 hospitalizations since this year. She keeps on going and she keeps on coming. So the providers think that probably she's framing things up and all that and all that. So they had the diagnosis, like I said, is factitious disorder induced by self. How the impact to the psych nurse health practitioner. So this disorder actually like expanded my knowledge about psychopathology. So the thing is that this situation actually it doesn't give a clear demarcation, or it doesn't give a clear difference between self manipulation and like unconscious psychological problems, because it will be too difficult for you to differentiate if this situation is like self-induced. Are they being framed up? Is she being, maybe is she manipulative? So this is the problems. This is like the problems that comes up like as a psych nurse health practitioner. So however, it is to my understanding, it helps me to not to be judgmental about any patient, because people usually that present with this kind of situation, probably they might be undergoing like some kind of trauma or some kind of abuse. So at this point, one might not be interested in sending different investigations and all that. No, because investigations might not show you anything. So here, this is where questioning, interviewing, using the therapeutic interviewing to find out if there is something on the ground. Probably if the patient has like childhood trauma, or if there is any abuse going on, maybe they are trying to hide away from the abuse, maybe at home or things like, by then coming for hospitalizations. These are the things that we as a psych nurse practitioner, we have to like inquire about. We have to dig deep to find out about these things when this patient comes on and off. Also, one of the impacts as a psych nurse practitioner, is the collaborative involvement of other members of the healthcare team. Because at this point, like I said, she comes with seizures, she comes with GI, so we had to like put in some GI consult and also read the previous GI consults, even the neurology consult, because they've done EEG for her, they've done some brain imaging, they've done all these things. Nothing is they've not really figured out what is going on. So it's comes to my knowledge, it helps me to know that the collaborative importance of other members of the healthcare team as a psych nurse practitioner. So talking about my strengths and limitations, on my strength part is the ability to develop rapport with this client, because when we started talking, so I started like having good rapport. We started talking, I started asking different questions, started asking about her, what she does for a living, other aspect of her life. By so doing, we had a good rapport. So this is something I know that is one of my strengths. Another thing is not being judgmental is a strength I have, because at all points there is no smoke without fire. So they could say she is manipulative, or probably she's inducing all those symptoms, but there could be a cause for her to induce those symptoms. There could be a problem somewhere. So at all times, I am not judgmental. I do not judge people of any mental illness. I do not judge people of any disease problems or why they should be in the hospital. So this is one strength I have developed during the course of my practice. So, reflecting on the therapeutic use of self. So, at all times, despite the complexity of this condition, despite the difficulty of this condition, I maintain my ground. I continue to be empathic. I continue to be non-judgmental. I continue to, have rapport with my patient in order to help me know the best possible way to help this patient. Talking about the specifics I learned and how I'll be able to apply it in the future in the future role. First of all, I will meet people with this kind of situation whereby it will be difficult to actually figure out if these things are consciously induced symptoms or unconscious symptoms. There will always be times like that. So it's something I have to reflect on and off. Another thing is that based on the complexity of this condition, I keep reflecting that at some point, as a psych nurse practitioner, it will not just be about medicine refill. At some point, there might be use of investigations to help a client to figure out what is going on with a client. Also, reflecting on this situation, I appreciate the collaborative efforts of other members of the healthcare team. That means in future, there will be a situation whereby I will need to put in consults. I will need to refer patient to other members of the healthcare teams to help me figure out what is wrong with the client. Also, reflecting on this condition, in future role, at all times, I do not have to judge people. I do not have to judge patients. There could be like an underlying or underground cause why a patient could try to manipulate symptoms. By the way, nobody wants to be sick. Nobody wants to come to the hospital. So in situation whereby you feel like people are manipulating symptoms, then there should be undergoing problems, probably traumas, probably abuse, which calls for more investigations. Thank you so much.